Today we will see about use of personal and productive equipment. I am Niveta, nursing tutor from Sri Shanmuga College of Nursing for Women. First of all, introduction. As a nurse, we play a vital role in preventing the transmission of infection. Most infection control methods are independent in nursing activities. We do not need an order for them. You do need theoretical knowledge in medical and surgical aseptic techniques. Most infection control measures are independent nursing activities. So, because the patients, many patients like COPD, hepatitis, HIV, AIDS, so many bloodborne infections also there, respiratory tract infection also there, and severe bleeding or wound septic. So these are the patients handling from nurse and emergency care also given. So that time the prevention of infections ourselves to transmission and also contamination of infections. Okay, so that way to use very important use of personal and productive equipment and need theoretical knowledge about aseptic techniques also. What is PPE? Personal protective equipment means the equipment which are used for the safety of individuals. Personal protective equipment must be used when necessary because of hazards encountered that are capable of catching it. PPE does not prevent the hazard but can save the lives of those who work in such conditions. So PPE is used for safety individuals and because of hazards encountered. So it is prevention of infections and to provide interventions. And definition. Personal protective equipment is refers to protective clothing, goggles or other garments or equipment designed to protect that wears body from injury or infection. It's a very important point. So personal protective equipment is specially designed for protect that wears body from injury or infections. Then protection against health effects and safety hazards. It is designed to protect many parts, example eyes, hair, face, hands. Then please make OSA. OSA stands for Organization Safety and Health Association. Is specially designed for agency of the United States Department of Labor. It has prepared certain standards for PPE which are given below. Assess the workplace to determine if hazards are present. Select the provide appropriate PPE that fits each affected. Train employee on how to use PPE correctly. These standards given by United States Department of Labor. So what are the types of personal production using in medical field? Okay, eye and face production, head production, food production, hand production, respiratory production. So eye and face production, head production, food production, hand production, respiratory production. These are the types of personal productive equipments using in the medical field like hospital area. Purpose of PPE: stop the spread of infections, protect the health, protect the client's health, protect their family's health and community health. These are the purpose of PPE. PPE available. Personal protective equipment kit, gown, aprons, coveralls, shoe covers, hair covers, respirator mask, goggles or faces, gloves. So these are the PPE available, kit available. So now I show the picture. So this you look at this picture: gloves, face shields, biohazard bag, fly mask, cover rise, and shoe cover. So this is for the personal protective equipment kit. It is mainly used in hospital, critical care unit, intensive care unit. So COVID-19 period, these personal protective equipment kit used. Gloves. It protects hands. Gowns and aprons uses for protecting or clothing. Mask and respirators. It protect for mouth and nose. Respirators protect respiratory tract from airborne infectious agents. Goggles protect eyes. Face shields protect face, mouth, nose and eyes. PP used in healthcare settings. Gloves. So gloves is specially used for touching blood, body fluids, secretions, excretions, contaminated items for touching mucous membranes and non-intact skin. Example, the patient or TA or severe bleeding, that time to wear the gloves. Why to wear the gloves? So easily the blood will be appear on hand to easy to transmission of bloodborne infections like HIV, hepatitis, etc. So that avoid purpose to wear the gloves. So whenever you touching the blood or body fluid secretions contaminated items, that time compulsory or mandatory to wear the gloves. That time only you self avoid bloodborne infection. Then gums. Used during procedures and patient care activities when contact of clothing exposed to skin with blood, body fluids, secretions or excretions is anticipated PPE used in healthcare settings. This is very useful. Already saw the picture gowns. So the gowns is used for blood or body fluids. So mainly the gowns used in operational theatre and labor ward. Then mask and goggles or face shield. Everybody knows about mask and goggles or face shield. It is familiar about because everybody known about the COVID-19. That time many person to wear the mask and goggles or a face shield. So used during patients or activities likely to generate splashes or sprays of blood, body fluids, secretions or excretion PPE. Mainly it will prevention of transmission of respiratory tract infections. So that purpose only need to wear the mask and goggles or face shields. Then, what are the factors influencing PPE selection? Types of exposure, anticipated durability, and appropriation for the task fit PPE used in healthcare settings. So these are the factors influencing of PPE selection. So, which places to use in PPE? Role of infection control professional. Who are the role of infection control professional? Like intensive care unit working nurse, doctors, or other multi hospital workers, and then critical care unit work and emergency ward. So these are the area more infectious. So operational theatre. So these are the working medical professional comes under role of infection control professional. Then specimen collection. So laboratory persons or other specimen to be collected, that time uses in PPE. Then bagging trash or linen. If the linen is very contaminated or the linen was very bloody, that time used in PPE. Then transporting patients. So shift the patients from hospital to hospital or transporting patients from either ICU to ward. So that time to wear the using PPE. Surgical asepsis. Surgical asepsis means if the any suturing or any operational of the patient, that time to wear the PPE. Then patient education. If the patient having for any respiratory problem, that if you have educated, that time you to uses in PPE. Then key points about PPE. So what are the key points about PPE? Done before contact with patients, generally before entering the room. Okay, so what are the key points about PPE? Done before contact with patients. So whenever the patient comes with the hospital and admit to the ward, that time you you wear the PPE like mask, gloves. Okay, so generally before entering the room, okay, especially for admission of the patient and discharge of the patient, these time you are communicate the patient. So already you know about whatever, whenever you touching the patient before and after to wear compulsory PPE. Use careful, don't spread contamination. Remove and discard carefully either at the doorway or immediately outside patient room respirator outside room. Especially in isolation area, in the hospital field, in isolation area, compulsory to wear the PPE because to prevention of transmission of airborne infections from patients and families and from ourselves. Okay, so then immediate perform hand hygiene. So whenever to before wear the PPE and after remove the PPE, that time immediately perform hand hygiene. Hand hygiene is very important. It is very important because it is only to prevention of infection, transmission of infection, and prevention of contamination. So hand hygiene is very must. Okay, so in overall slides, know about what is PPE, wherever area to be used. Okay, so it is comes then to be continued. So next part we will see PPE, how to wear, how to remove, like donning or dosing. So next video we will see about part 2, use of personal protective equipment, how to wear and how to remove. So please stay tuned. Thank you. Thank you.